Hello, my name is Iona Green, and I will be talking about childhood obesity. Have you ever wondered what childhood obesity is? If you were a parent of a child who was faced with this condition, would you know what the symptoms are? Childhood obesity is a medical condition in which excess body fat has accumulated to the extent that it may have a negative effect on health, possibly leading to reduced life expectancy and/or increased health problems. Did you know that obesity has nearly doubled since 1980? And 42 million children under the age of 5 were overweight or obese in 2013. Although childhood obesity is increasing in all ethnic and racial groups, its prevalence is higher in non-white populations. The reasons for the differences in prevalence of childhood obesity among groups are complex, likely involving genetics, culture, socioeconomic status, and entertainment. Centers for Disease Control and Prevention tells us that approximately 17%, or 12.7 million of children and adolescents aged 2 to 19 years had obesity. The prevalence of obesity among children aged 2 to 5 years decreased significantly from 13.9% in 2013 to 2014 to 8.4% in 2011 to 2012. It also tells us that there are significant racial and age disparities in obesity prevalence among children and adolescents. In 2011 to 2012, obesity prevalence was higher among Hispanics with 22.4% and non-Hispanic Black youth with 20.2% than non-Hispanic white youth with 14.1%. The prevalence of obesity was lower in non-Hispanic Asian youth with 8.5% than in youth who were non-Hispanic white, non-Hispanic Black, or Hispanic. According to the Mayo Clinic, lifestyle issues such as too little activity, too many calories from food and drink all remain a significant contributor to childhood obesity. Due to lifestyle issues, complications come into place such as type 2 diabetes, which affects the way your child's body metabolizes sugar. Metabolic syndrome, which is a cluster of conditions that can put your child at risk of developing heart disease, diabetes, and other health problems. High blood pressure and high cholesterol, which comes from a poor diet. Asthma and other breathing problems, sleep disorders, and non-alcoholic fatty liver disease. There are also social and emotional complications, which includes low self-esteem and bullying, behavior and learning problems, and depression. Childhood obesity can be prevented and is highly recommended. Some ways to prevent childhood obesity would be to schedule yearly well-child visits. Well-child checkups should be done at least once a year. Be sure that during the checkup, the doctor checks your child's height and weight and calculates his or her BMI. Always remember that an increase in the child's BMI over 1 year is a possible sign that your child is at risk of becoming overweight. Set a good example by eating right and exercising. This will help keep you healthy. Avoid food-related power struggles with your child. Avoid using food as a reward, especially sweets. Emphasize the positive. Encourage a healthy lifestyle by highlighting the positive of playing outside, eating fresh fruits and vegetables, and exercising. Be patient. And lastly, be responsible about your own weight. Be the change you would like to see your child take, for every change starts at home. Thank you.